Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, last week we did a little segment on data breaching and security. We're going to continue to do that, this time with utility cybersecurity. But first, we're going to hear from the Pennsylvania Healthcare Association, and we're going to talk about long-term care, the implications and the future of long-term care for you. We'll do that after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, sitting across from me, as often is the case, is Russ McDaid. He's the president and CEO of the Pennsylvania Healthcare Association. They do a lot of work on behalf of seniors, those seniors who are thinking about, though I got that right, Russ, thinking about or actually in long-term care situations. Am I right about that?
Right on both counts, Terry.
Okay. Let's start with something perfunctory, I know. We're going to get in a little bit later to the future of long-term care, skilled, the whole business of what you all do. But you're impacted by the state budget, correct?
Yes, we are.
So what's the situation with long-term care in the state budget, and then what do you use it for? Let's start with that.
Yeah, well, and first of all, thanks for having me again. As you know, the governor's budget was released in early February, and unfortunately, again, we feel like it missed the mark in providing adequate funding for our seniors who require 24/7 round-the-clock care in skilled nursing and rehab centers.
Right. Let me say something. I might have mentioned, we talked about this a bit before, but is there any family you can think of that somewhere along the line, usually the kids, but other relatives are saying, what are we going to do about grandmother and grandfather? And they need care now. And there's virtually, in many cases, little planning about that. And that's where you come in.
Oh, and you're absolutely right. And I mean, when we talk about it in the context of the state budget, when you and I go to the hospital or to a doctor's office, we have a private insurance card, and that pays for our care. Here in Pennsylvania and a lot of other states, almost 2/3 of the care provided in our nursing facilities is paid for by the state and federal government under the Medicaid program.
That's correct.
And it's that Medicaid funding that's falling well short of meeting the needs of our seniors residing in skilled nursing and rehab centers. That's really at the center of the issue. And families don't take the time to know when Medicaid kicks in, when Medicare kicks in, and who pays for what when.
No. And here's the difference. The discussions that I have with my friends are, well, remember, I can't give them, I love my grandmother, but I can't do what they need. They need 24/7 care.
Yeah, you use the word need, Terry, and that's the right word. It's about need. Now, our facilities today aren't caring for people who don't need to be there. And that is the challenge we face. We all want what's best for our loved ones. And in many instances, what's best for our loved ones is that round-the-clock skilled care that only our skilled nursing and rehab centers can provide. And we've got to find a way to do better for them as this budget process moves forward.
And the other thing you point out is that a fair number of people will go in for a short period of time and then go back once their medical condition is, reduced, minimized, or even eliminated, right?
Yeah, that's right. I mean, the nursing home of several decades ago no longer exists. In the 1990s, people used to go into nursing homes and live there for years. And in the 2000s, it went to months. And now we often find, here as we sit here talking in 2017, folks needing only weeks of care. But it's pretty heavily intensive and costly care to get them back home when they can go home.
Well, then, let's go to this sort of an important second question, which is, how does the budget affect long-term care in this state?
Well, we as Pennsylvania taxpayers, we look for a lot of things from government. We want government to provide us with safe communities. want us to provide us with safe bridges and roads when we travel where we're headed, a high-quality K-12 education, and we also want the government to provide us with high-quality care for our seniors. And as I noted, the state pays for roughly 2/3 of the nursing home care in the Commonwealth, and so that funding comes directly out of the budget process that started with the governor's budget address, ends when we have an enacted budget, and that's why it's so essential that everybody think through the commitment needed in the budget to our seniors.
Yeah, and the budget would cut access. That ultimately, isn't that your point? When it all comes down, it's about access, and if the budget's cut, then fewer people have access.
That's absolutely correct. I mean, in 4 out of the last 6 years, I'll give you some context. 4 out of the last 6 years, there's been no funding increase for our skilled nursing and rehab centers and Medicaid under the budget. If the governor's proposed budget were to go through as offered, it would be the 5th year out of the last 7 that we haven't seen an increase. We've seen a number of high-profile sales in the Commonwealth recently. There's a lot of change in this landscape, and you know, each and every day, our members are challenged to make the investments that they want to make in their staff and their residents because of those funding difficulties.
And I'm not even going to get into the issue of the changes to the Affordable Care Act and what might happen to Medicaid in this state, where something like 700,000 people are on Medicaid, right? And I'll skip that. We'll get you on and do that at another time. All right, we're going to run to a break. We're going to take a look in the next segment of the challenges facing long-term care. We got into a bit of them, but there are more, and we'll do that following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. I'm chatting with Russ McDaid. He's the CEO of the Pennsylvania Healthcare Association. He's one of the regulars we have on from time to time to bring us an update on an important element of Pennsylvania residents, senior care. All right, look, as we talked about, there's a lot of resistance, as you know. We talked about that. People don't really want, but when they go, what do they want? When you finally get in a nursing home, what? You hear it all the time.
That's absolutely right. You want high quality care once you get there. You know, I don't want to need open heart surgery, but if I ever need it, I want there to be a high quality hospital available. Yep. We don't want our loved ones to have to go into a skilled nursing facility. When they do, we want to make sure that the right one's there to meet their needs and that they have a highly skilled and trained staff ready for that.
And you did a poll. You have a poll that your organization conducted, and were there findings there that our viewers shouldn't be aware of?
Yeah, actually, I mean, we've been out asking Pennsylvanians what they think about these issues, and in December, a private corporation did a poll of 800 registered Pennsylvania voters and asked them a number of questions around long-term care, and almost 90% of the individuals polled said that cuts to Medicaid funding for nursing facilities was unacceptable to them. We asked them where those things ought to be prioritized, and funding for our seniors who need that 24/7 round-the-clock care ranked ahead of a laundry list of other things that state government does, including, frankly, some of those that I named off earlier, you know, public safety, roads, education, highlighting, you know, you never like to pit one against the other. The fact is, those folks who were polled clearly understood that with an aging population and with a sicker population, we need to make strong investments in our facilities. 2 million
of the 12 million of us, I'm rounding off some numbers here, you know, that reach, 65 have, you know, we have an elderly population, and the longer we live, and we are living much longer. Folks are living into their 80s and 90s now. That ratchets up. Finish the thought. Ratchets up the need.
That's right. There's a stat out there that 3/4 of us will need some type of long-term care in our lifetime, and once you make it to 80, the likelihood that long-term care will be some sort of a 24/7 round-the-clock stay in a facility increases significantly. So you're right, Terry. The more, we're living longer than ever. We're healthier longer than ever. We can be very active through our 60s, 70s, and 80s. However, we're going to see more and more Pennsylvanians in their late 80s, 90s, even over 100, and we need to invest in care and services for them.
All right, we're going to go to a break. When we come back, I want to ask you another question dealing with misconceptions about nursing care. I think a lot of people are just generally, I should say, unfamiliar until they go and get the orientations and find out what actually happens. And there are some misconceptions, and we'll give you a chance to clear them up. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
All right, Russ McDaid, let's get this. There are some misconceptions about skilled nursing. Actually, I think it's more that people don't know a lot about it because they don't have daily contact.
The biggest thing that I hear is that there are a number of people in nursing facilities who could be cared for elsewhere, that they should be out in the community in their homes instead of in the facility. I got to tell you, I tour our facilities regularly, Terry, and I don't see people who don't need round-the-clock care. And as I noted earlier, a lot of people are able to go home, but not without that high-intensity, high-cost care in a facility on the front end.
Yeah, so they have to make a whole variety of changes. Nursing homes, long-term, are always going through constant change.
That's
and that
absolutely
requires this, green.
It requires cash. It also requires a skilled workforce.
Yeah.
I mean, when we look at one of our largest challenges, our largest challenges are two. You said it's about cash, and I've mentioned the budget shortfall and the fact that we need more help from the state budget for our skilled centers.
Okay.
People are the other one.
I wanted to get this in. Coming up, we have Terry Fitzpatrick. We're going to get into utility cybersecurity. It's a very important subject. We'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives.
Well, welcome back. Terry Fitzpatrick. He's the president and CEO of the Energy Association of Pennsylvania. Many folks know him as a former, you want to help me out, Pennsylvania Utilities Commissioner. How long were you commissioner?
PUC. For about 8 years.
Yeah, I thought so. I mean, I don't know how you all do that. That has to be one of the toughest jobs. Is that the toughest job you ever had?
It can be tough at times when rates are going up. I started there as a lawyer right out of law school, though, so I had a lot of grounding. I knew what I was getting into.
I got it. And sometimes that's not the way it works, right? They end up bringing people. So you were already you understood all the mechanics and the nuts and bolts. Tough job, guys.
I had pretty good training for it.
There you go. All right. What have we heard lately? We've heard about the Russians hacking, Americans hacking, the federal government hacking into cell phones and cameras on TVs like we have. You name it. It's people are probably watching us as we're taping it, other than the folks in the control room. And not a lot of talk, and this is why it's great to have you on, about utility cybersecurity. What's that mean?
Well, it's what utilities do. Utilities, of course, are a critical piece of our infrastructure and of our ways of life. So it's all the things that we do to protect our systems to keep the natural gas flowing and to keep the electricity flowing into our homes, because it's so important. It's critical to our national economy.
Yeah. So are you telling us that given the technology, and this has happened other places in the world, right? This is not new, that you could have your electricity shut off, and what other utilities presumably would you lose besides electricity?
Well, back in 2015,
right.
Hackers, I think Russian hackers, got into the Ukrainian power grid.
Yeah.
They got in through email attachments sent to employees, which they maybe shouldn't have opened, that they opened it, burrowed into their system, and shut down part of their system. So you had power outages caused by this. So that's just an example of what can happen. There's been awareness of this threat, for quite a while. I think it's grown over time, the concern about it. And there are a lot of things that are being done by utilities, spurred by regulation at the state level by the Public Utility Commission, but also at the federal level. You've had agencies, any number of agencies, put out some standards that we're following. And there's industry groups that are talking about this all the time. So you never want to say that you're doing enough. Yeah. You never want to rest on your laurels, but there is a lot going on. There's a lot of attention being paid to it.
The one thing that's fascinating to me is I'm still shocked that when you learn about what they can do.
Right.
Whether it's the folks who've stolen stuff or have gotten information, that about our own government, put that information out there, and the impact that has. And, we probably don't know the ultimate consequences of that anyway. But when you think about the implications for a grid shutdown of some kind that affects the way we travel, affects, where we get up in the morning, whether you have heat in the winter, right. Probably more important than air conditioning. You at least open up the doors and the windows. And is it possible that the disruption could be not just days, but weeks or months, or do you think that's out of the question?
I never want to say anything's impossible, but part of what the companies do is, well, first of all, you take steps to defend against an attack. And that can run from anything as simple as just basic password protections, make your passwords robust. I mean, that seems like a pain to most people to have long passwords. I got to interrupt you right
now. Every person we've had on talking about that has said the same thing.
Right. Well, that's one of the most basic things. But then there's more and more sophisticated things that probably I don't understand that our members do. And I wouldn't explain it if I could, because that's the kind of thing you do to try to prevent something from happening in the first place. But we also have to file plans with the PUC to restore for how we're going to restore power in the event that it does go out.
Can you tell me a little bit about that? I mean,
well, it's basic things like we work with the Pennsylvania Emergency Management Agency. We have people who go there to the PEMA Center when there are outages. And we do, unfortunately, in the electricity side of the business, we do have some experience with that, because when you have storms and you have widespread outages.
Or people run into telephone poles.
Right, yes.
I'm not being jocular about it. It's serious, but that causes...
Yes, it does. But we have experience with widespread outages and how we get people back on, how we communicate with local officials, how we communicate with the Commonwealth, how we deal with road closures, how we deal with integration, with coordination among different types of utilities. Because, for example, a wastewater plant can't run without electricity. So they do have backup power, but we do coordinating with those groups.
Yeah. Is there a role for government in all of this? What's the role for government?
Well, government is setting basic standards right now. Now, those standards aren't always very detailed, but this is constantly changing, so that's probably appropriate. And there's a lot of coordination that goes on. The PUC, for example, calls in... I was just
going to go into that, ask you that about the PUC.
The PUC has set up...
Utilities Commission,
has set up a critical infrastructure interdependency working group. Now, there's a lot of acronyms in this area, but really it's just getting electric utilities, gas utilities, cable operators, water companies, wastewater companies talking about what they're doing and how they'll coordinate things, in the event of this kind of outage. The PUC also calls in our members with their cybersecurity experts and has private conversations about what they're doing, asks them questions. And that's a particularly appropriate form of regulation in something this complicated and this, something that's ever changing.
You know what? This is A, complicated, and B, I just thought about how many organizations, associations, companies are involved in supplying the services that we need.
Yes.
And we, for the most part, I don't mean it meanly, but we take it for granted.
We do. I think it was 2013, President Obama issued an executive order on critical industry infrastructure protection. And under that, there were some standards set. But yes, you're right. The financial services industry is important. That's another example of one that, and I think you've had them on talking about cybersecurity.
Exactly, particularly what they call data breaches into credit cards. And I'm thinking, if they can get into our homes, into banks and credit unions, into the essentials of what, these things that we live with every day and probably can't do without. I mean, they could attack an entire infrastructure, plus how we literally get services that we need to live.
That's why so much attention is being paid to this. And I think it's appropriate you picked up your cell phone because, it's a real blessing overall. The internet, all the information we have access to through all these devices. But all of those devices are potential pathways for people who are looking to do harm to our society, too. So it's a real challenge keeping up with all of that.
In addition to the state involvement, which you're an expert in, having been on the PUC and the work that you do, is the federal government attempting in any way to regulate this?
Yeah, if anything, there's more going on at the federal level
than most states.
Yeah, for example, with electricity, the Energy Policy Act of 2005 set up a regulatory system where industry experts were called in, standards were set. There's fines possible of up to $1 million a day if any electricity company does not follow those standards. Also, you have on the natural gas side, you have standards set by the Department of Homeland Security about how to keep pipelines safe. So all of those things are kind of the backbone of a lot of what our members do. So there is overlap between federal and state government here. It isn't inconsistent, but it's just you have a lot of people trying to keep this on track.
Yeah, I mean, this seems not just also extraordinarily complicated, but I think it's a lot of things that most of us, it's an element of our society that most of us don't even think about until we flip a switch and something doesn't go on or we get a power outage in a community. Is there much, I mean, why I'm delighted that you're here is that we're talking about this, but I must say, I don't hear a lot of other considerations, other public programming on this. This is something we should be doing a lot more with.
I agree. Well, it's kind of generally true of utilities. It's one of our facts of life.
True.
People tend to take it for granted. As you said, you turn on the switch, electricity is there, your house is warm, the gas is running.
You're mad when it isn't there.
Exactly.
Yeah. And the long-term future for this, are you reasonably comfortable with where we are now? I'm sure you say there are always changes we can make. We have to evolve. What's it?
Well, you never want to be complacent, but there's a lot of effort being put into this. We really are paying attention to it and taking it seriously.
Yeah, first time, I think, this could only continue to grow. My sense is that this is only going to get more complicated and worse over time.
Yeah, we're going to be talking about hacking for quite a while, if we're not sick of that term already, right?
Well, this is the second week we've done this on Pennsylvania Newsmakers, and I don't think we talked about this maybe once a year, if that. Right. But we expect you to come back and bring us up to date on this.
Be happy to do that.
We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.